Let's get things going. My name is Serese Selanders. I'm the founder and CEO of SolusGuard. Before we begin, though, I'd like to take a moment to acknowledge the land from which I'm joining from today. I'm speaking to you from Saskatoon, Saskatchewan, which is located on Treaty 6 territory, which is the traditional lands of the Cree, Saulteaux, Dakota, Lakota, Nakota, and Métis peoples. Now, as a settler with colonial roots, I want to acknowledge that my ability to live and work here is made possible by these lands and the people who have cared for them for generations. I also want to acknowledge the ongoing impacts of colonialism and the responsibility that we all share to approach our work with humility, respect, and a commitment to learning. As I said before, I'd like to invite you to share in the chat where you're joining from today and your organization, which would be great too. So with that, the reason why we're here, I'm honored to introduce our guest today, Robert Gorcak from First Nations Health Authority, and I will pass it off to you, fine sir.
Well, thank you very much, Serese, and it's an honor to be here. I really appreciate the time that we get today and to share our journey in working alone in isolation as it relates to our endeavors and operations. I will acknowledge that I am calling in from the traditional unceded territories here in the lovely Vancouver coastal mountain area of the Tsleil-Waututh, Musqueam, and Squamish nations, where I am an uninvited guest on the land where I would live, work, and play. And I am myself a mix of First Nations and colonial ancestry. I'm Haida Nation Skidegate band member of Haida Gwaii on the beautiful coast of British Columbia. And for in your area too, I come from Treaty 6 territory, the Atakakoop Cree Nation. I am descended from them as well. And on my colonial side, 4/4 of the Canadian loonie, as they call it. So pick a quarter of Europe and put a flag there, and that's where part of me is from as well.
Nice. I love that. Robert and I have had a chance to share conversations and stories, which is amazing, which is why I'm really excited, why we invited him in the first place. Just deep knowledge and experience. Your background is quite extensive, is it not? More than just First Nations Health Authority.
Yes, so I obviously serve in the capacity as Director of OHS and Psychological Health and Safety here at First Nations Health Authority. But prior to my 3 years that I've been here, for the last 20, I've been in everything from high-risk work in industrial, oil and gas, energy, big capital projects. For anybody joining from the Lower Mainland, you'll know the Broadway subway project. I was on there before I came over to here. So yeah, it's just a depth of experience and knowledge and a lot of diverse geographic regions and diverse projects, and from moderate to high risk as well.
Well, if you might recall this, Robert, when we first met, and that was through our introduction through Can Health, and they had introduced us, and you and I had a chance to talk. I deal with lots of organizations and a lot of different backgrounds, but you might recall that I said, this is not your first rodeo, is it?
Definitely not. We encounter so many different examples of this in all the different areas that I've been in. So like oil and gas, you're out in the middle of nowhere on leases and rigs that have zero cell phone communication. You look at confined space access in a lot of civil projects, things like that. It's just driving on highways, the travel, all aspects. But I will say, coming to FNHA, I don't think I've seen such a diverse need when I came here. So we're very lucky that CanU Health was able to put us together. We went through a trial of several different products. We had some legacy stuff, some that we kept and some that we'll be phasing out as well. But that was so critically important that CanU Health was there to also introduce us, because I don't think we'd be as satisfied with where we are our approach to working alone in isolation as if we hadn't met you. We'd be still struggling with a few other providers that weren't necessarily meeting all the needs that we needed. And it was an honor and a pleasure to get to meet you early days and get to understand your guys' product, because it does respond to so many of the nuanced gaps that we had in our programming. And I'm always one to try and keep things in a narrow gap as opposed to many different options trying to satisfy something as complex as working alone in isolation.
Well, I appreciate that. And just for the folks watching, we did not pay him to say that. This is not how we were going to start at all. So thank you for that. I appreciate it. This is not about us. So let's go straight into some of the questions you and I had had talked about. And just from what you said a few minutes ago about the diversity of geographies and communities. So for the audience, can you paint a picture of what lone work actually looks like day to day and how those risks change between urban adjacent and truly remote settings?
Well, FNHA is obviously very unique. We are the first of our kind organization within Canada, specifically addressing the needs of First Nations communities across British Columbia. So, as we all know, that's our provinces in general are massive land territories, and they come with all sorts of challenges, especially British Columbia. You know, where you have everything from ocean, land, sea, air, huge mountain ranges, huge expanses of flat areas as well. And then where we operate, FNHA operates remote nursing stations where the only way to get to it is 9 hours down a service logging road in the middle of a mountain valley. Two more urban and traditional primary care centers that are centrally located to flex work arrangements. So workers working from home or an office location. How do you manage that? A lone worker risk as well. So just and high travel. A lot of our team members are traveling down highways with spotty cell phones coverage through those mountain passes, or they're on float planes, biplanes, seaplanes, you name it. The only thing I don't think we travel on a regular basis is train, but even then we have people coming on the West Coast Express here in Vancouver. So planes, trains, and automobiles are literally the name of the game for the travel aspect. And operationally, I think one of the few things that we don't operate is a general store. We pretty much do everything else. And there's 203 unique First Nations communities. We obviously service them in very different ways in British Columbia. We're one of the most diverse in the amount of independent communities across Canada. There's 5 distinct languages from the First Nations communities. Various different economic and socioeconomic capacities from each of those communities. And so FNHA does a series of different things. Sometimes we write a check and help with some governance and help with capital expenditures, but really just community runs their operations on their own. Or we're directly involved and we're supporting running an operations center such as a remote nursing station or primary care. So it is about as diverse as it comes.
Wow, I'm exhausted and I'm just listening to you. I don't know how you manage that. So you talked about extreme diversity, obviously, whether that's roles, locations, risk profiles. How does a FNHA decide which lone worker risk to focus on? I imagine there's significant ones, and what tends to get underestimated in healthcare?
Yeah, so one of the things that we looked at is that there's we look at the classic example of what our regulation says. So we have a regulation, obviously, across Canada. Some are on the federal side. For us, we are the province of British Columbia. We are a provincial organization, and so we look at the regulation as it speaks to us, which anybody that is working alone or in isolation, or any that may be in need of assistance if there's an illness, an injury, or an emergency. That's the justification of how we will approach it. When we do that, we obviously do our risk assessment. So we do HERA and look at a risk assessment across our whole organization. So when I came into FNHA, there was a bit of a gap in the frequency. Risk assessment should be done annually. There was just a lot of languishing. We're a young organization. 13 years ago, we took over from the federal government as part of the tripartite agreement. So instead of Health Canada spending all the money and deciding where things get spent, FNHA was formed out of that. So the 203 or so nations in British Columbia came together, signed the agreement with Health Canada and with and the federal government and the province of British Columbia and the Ministry of Health, and that formed the tripartite agreement. Obviously, our priorities have shifted over 10 years, and our footprint and our capacity is growing. And the needs of our workers have really evolved in that time too, and the priorities of what we need to look at as an organization. So when I came in, we were kind of in that transitional stage of small organization with big dreams to big organization, still pursuing those big dreams. And we had much more to pay attention to. So for the first year, it was really a lot of assessments on what's going on, find out where the high risk activities are, what has historically happened, and where was that? So obviously travels really sits itself at one of the top echelons of things that we need to pay attention to. Loss of service. Another thing when looking at travel that we look at is connection and connectability. And does an SOS button help if you have a flat tire in the middle of a 9-hour service road? Yes, but also no. We don't want to be dispatching the National Guard to go save you when you just have a flat tire. So satellite connectivity, then how does that play in? Well, do we need a satellite phone? Well, that's a high expense to maintain a satellite phone for minimal usage. So we needed to look at how we could have other processes in place that would fix that aspect of it. And then the other aspect was our violence prevention. So violence in healthcare is a big one. And we looked at an approach, with a lot of these remote nursing stations. They weren't built. They were built by the federal government. We've taken them on and taken them over, and they weren't. There is no emergency call buttons built in, and for those that have, that service is long time dissipated, no testing, and so we needed another solution to address that. What happens when a remote nursing station nurse gets called in after hours and goes in? There's always an on-call nurse and stuff, but there's not necessarily the best cell phone connection in community, if there is any at all.
Right.
And how do they get that emergency alert to the nurse on call, the nurse on charge, and progress up so that there can be somebody coming down there? And then also being grounded in the realization that that button that doesn't mean that help's going to appear when you push the button. And what does that look like? And making sure that they have strong processes behind that as well, and training behind that as well. So it's not just a one button saves and solves everything. It's all the procedures and all the training that goes into that as well. So those are the two that we really elevated to the highest risk potential and in need of being addressed immediately. From there, we kind of work backwards and spread out amongst teams like our facilities and corporate services teams that are traveling still to these remote communities and have been onboarding them. And it's really been a calculated and slow rollout process, really thoughtful in how we're doing it. And then also using the diverse set of some of the legacy tools that we have, some of the new tools through SolusGuard that we have, to really not force upon a solution to the team, but offer the team solutions that then they get to map out for themselves. And even though we know the direction they're hopefully going to go with it, we're able there to help guide that a little bit, but it's really about being a partner in the solution as well. That's really the buy-in and the change management piece that's so critical to making any working alone in isolation program a success. So,
and that makes total sense. And you talked about a significant amount of diversity. And so there's not going to be a one size fits all solution for an organization like yours. That totally makes sense. And so having multiple options that are going to not only fit the situation, but fit the culture, fit, different reasons, absolutely seems very prudent to do. So you go through all of this, you establish a lone worker safety program. And as you said, it's more than just tools. It's tools, it's process, it's procedure, it's all these things. Where do these programs most often break down, or where the assumptions don't hold up when you get into the real world health environment?
Yeah, I mean, there's several, opportunity like highlights that I can use. So obviously, I flagged the two real highest risk, moderate to high risk activities in working alone in isolation that we really have. And when I think about a recent example, we had a team in the northern region, so obviously a little bit more inclement weather, much like the rest of Canada. Vancouver's blessed with obviously the coastal mountains protecting us, but the rest of our regions in British Columbia are not, and they are just as prone to that, very low temperature, very high snow drift possibilities in the winter months. And we had a team that drives regularly between two offices on a very popular highway, but it has an intermittent cell phone coverage at part of it, and that's where they ended up getting run off the road.
Of course.
And so, the team never thought too much. Like they knew where they were going, and the management team, but they had zero communication about getting a tow truck. And when you're talking about -20, -30 degrees, especially in our chilly, very humid, cold in British Columbia, that can affect you pretty quick when you're out there. And they got nervous. They were a little scared. They couldn't get a call out. Luckily, there was a good Samaritan passing by there with a truck that was able to pull them out of the ditch, and they were able to get on their way. And sure, they would have been eventually noticed as not arriving through some of the other communication systems that we use, like Teams. A lot of people use Microsoft Teams just to check in the morning with their when they're working from home. But it really was a failure point. It was like, okay, do we need to go a little higher? And so that's part of that communication that we really needed to get out, and that we've been working on, is bringing that awareness through our various forums with our regional teams. We divide the province into 5 regions, just like our broader health authority system does in British Columbia. And it's really about spending time with management and those teams, and working on that change management and understanding where their gaps in their processes are, and working with them to do those risk assessments. I think that's what has driven home from that example. The other side of it is the violence prevention side, and where we've had interactions where people are nervous, they're blocked off, or they're sometimes clients of ours that are in community, or that come in at various levels of health and wellness, and also may have trauma in their past. So cultural safety and humility in healthcare is a big thing across Canada now, and we obviously are a huge component of that. Of the standard. So FNHA is actually involved in the new redesign, as we were in the first design of the cultural safety and humility standard. And that approach of trauma informed, it is ingrained in where we go. So knowing that these systems are great, and a button, and being able to communicate and have people be aware of when there's a safety issue, but that doesn't take away from having the skill sets of de-escalation, and knowing not to get yourself trapped in a corner, and facilities by design as well. All of it needs to work together to have a fulsome response, and to be able to support all our workers and all our management teams in implementing a health and safety workplace that responds to working alone in isolation.
Absolutely. And this brings me to what I'm thinking next, in terms about the intersection between culture, trust, and adoption, and all the things that you've been talking about, components of this. So how do you build trust so safety tools, processes are actually used and not worked around by the frontline staff?
That's the hardest part, is that how do you make the buy-in happen on all levels? Like, it only works if somebody signs in or checks in and does the follow-up.
Exactly.
So we try to, my philosophy to safety has always been meet the worker where they're at. So my entire team, there's a bit of a transition from where we were, which was very much a stand back and a reactive team before I'd arrived here. Not through any fault, I would say. It's just we were a different organization than with other priorities. Mm-hmm. I have now made it the priority and brought to my executive that we need to be out there, and that includes budgetary expenditures to get out there to really get a fulsome assessment, but also hear and relate. And it's so relational, anything in safety, and especially working alone in isolation. We have teams that are, on Garmin, on different aspects of all these different products. They've been a patchwork of band-aids across the working alone in isolation portfolio in the organization. And, that's great that teams have taken that. So it's a lot easier to work with some of those teams that naturally try to champion this and recognize this. But we have teams that don't recognize this. And that's where that relational ability to come in. The other aspect of it is obviously meeting workers where they're at. So whether being our Indigenous workforce, which I'm a part of, or just any part of our workforce, they're at different levels of understanding. And so I always try to drive in, the whole objective of safety for me has always been 10 fingers, 10 toes, and a steady heartbeat, so you can go home and kiss your kids goodnight. And that really aligns with First Nations values and directives that have been gifted to us at FNHA. And so by tying that into our culture, our First Nations culture, it's very easy to build that bridge. And then it's helpful when you have technology that's easy to use. And that's always been a big driver too, is efficiency is, for efficiency's sake, isn't necessarily a good thing, but
absolutely,
user interfaces and the way that you interact with technology needs to be easy. It needs to be efficient in that regard.
Absolutely.
And so that's where we really lean into it. And then, as I said earlier, it's really about giving them the options of many different possibilities and many ways for them to interact with the technology, even though we might want them to interact one specific way, giving them that option and letting them explore. It's more curiosity. It's more, how does this work for me? What's the best option? When you have your team start asking you questions, that's when you know you're on the right foot. When they're asking, like, what does this one do? We want that engagement. And then beyond that, of course, it's that ease of use. Like, once they get the answer they want, how easy is it for them to implement it? How much support do they get when they have a problem? We never want them to get frustrated. That's the worst thing you can do, because it'll shut people down regardless of their background, and on all scales. If it's not easy to work with, if it's not easy to do, then it becomes that's a challenge in its own right, and can really block and hold up progression in this space.
I was chuckling as you're saying that, because we build our technology, we put it in the hands of our customers, and they're going to use it however they want. And I never really thought about the fact that we put it in your hands, and then you put it in your staff's hands, and then they use it however it is that they want. So, and it starts with simplicity. First it's got to be really simple and easy for them to use. And then, of course, from then on, that's what's going to keep them safe. But how they use it and what they do with it, it's not always within our control.
I think I had a conversation with you earlier too, and I was bringing some reference. It's like, if you want to figure out how to break things, give it to somebody who doesn't know how to use it and let them break it. And that's the one thing that I find reliable. So the less likely it is to break in those force moments, like that also usually speaks to how usable it is as well. So if they can't break it, then it's pretty usable. If they can break it, you got work to do still. So,
my staff says the same thing to me. If you want to see if it can be broken, give it to Serese. She's going to break it for sure. I do. I don't know why I break everything that we have. We don't want to say it's user error. Definitely not. But something along those lines.
Fair enough.
I've never been in your role as a safety leader. I can't imagine. I feel like you're kind of the sandwich, the middle part of the sandwich, dealing with the frontline staff and the challenges that they have, and then of course the senior leadership. And you're a senior leader, but leadership, and that relates to getting buy-in. That relates to getting funding. So how do you navigate that so that this technology is being used? Like we talked about it being simple, but beyond that and the complexity, what have you learned? What has FNHA learned about making both of these things work?
Well, first off, I appreciate you calling me low carb. So that. Yeah, and I guess in a way it's like trying to make it low carb to understand almost. I don't want to give them too much of the bread. Like it is about the meat, the meat of the issue. And so when I approach it, for those that have a safety background on the call, they'll know the difference potentially between safety 1 and safety 2. So safety 1 is the traditional KPIs, lagging indicators, things like that. So that's definitely has a space in safety still, and that's important. And of course, executives look to that to see progress and make sure that safety is being adjusted. But safety 2 is a different concept. There's a white paper written years ago about it, and it's gone into like HOP principles, and that's kind of the progression of it. And so I really like some of the aspects of safety 2 where it differentiates. So in safety 1, when we have an incident occur, we look at it as like, oh, this incident occurred. We need to go spend a bunch of money to fix that issue. And guess what? That issue probably isn't going to happen again. It's the nature of the beast. Yeah. It's the randomness of risk and hazards is that you're working lagging. So it's about being proactive. There's compliance, and then there's proactiveness, and then there's resilience in safety maturity. And so being resilient is at the top of the game. We're never perfect, but we are resilient. We can respond, or the response is built into our programming and stuff. I'm happy with being compliant most of the time, just in the reality and the fiscal realities. but we always try to go to proactive. And when you learn to communicate that to your leadership and use certain tools like the safety maturity scale, you find your change champion within your executive. In my case, I'm lucky to have a change championship and a change champion in my VP. He was formerly with BC Hydro, so a huge utility, massive safety requirements. He did come from the HR side, and safety is its own division. I am in the HR team here in healthcare. That's a lot of times where safety ends up in healthcare. But I was lucky enough to have him, so I latched onto that, and he recognizes what I'm doing. We follow the CSA standard for health safety management system too. That was new that I brought in. It was basically a claptrap of policies and procedures written by the policy team instead of the OHS team. Our board signs off on it. So all these things were bottlenecks for safety really being on the leading edge and being compliant. We are always lagging behind. So, I get it. Every organization on this call is going to be at different levels of that safety maturity scale, but I'd highly recommend you looking it up and seeing what that is, because there's examples of it online, and you kind of go across and measure all these different comments in that maturity scale, and you say, are we doing this? And that gives you that maturity and an audit of what you do and your processes, and are we meeting our requirements? These are so critical for executives to understand if you want to lead them from that reactive phase into a proactive or even just a compliant phase, let alone resilient. That's down the road. That's a long-term lofty goal. Those are really critical to making them understand and really. In my early days, I was told by us, I was in sales, and somebody said, you really want to put the leash around their neck and lead them around the store, in a high school job. And it still holds dear to me that these are the tools that you use as a leash. Not that we want to put anybody in a leash or lead them anywhere, but it's a good analogy for how do you get somebody from one point to another. And these are the tools that I use to really show that, we're in a better position. It also helps with things like retention, which in today's world of finding quality staff is so critical. If we don't have an ability to show that we are, that we're doing these things, if we don't supply our staff with a feeling of wellness and safety and security in our day-to-day jobs, they're going to go to the places where they do get those things. And so from an HR aspect, that's another selling feature, is that you're driving retention, you're driving staff wellness, you're driving resiliency within your staff. And so these things play a part in working alone in isolation when you really roll out a program in its fulsomeness.
Amazing. And there's just so many of things that I can riff off of that and pull out of that. I've been given a list. The audience is really quite engaged, Robert. And so I'm going to take a pause here from my questions. And I want to pull some of these out, because these are obviously people are very thoughtful about this and came prepped and prepared, which is, I shouldn't be surprised with some of the names that I saw on this chat. So I'm going to jump into them because they're pretty darn good. I'm reading them. Before you started making improvements to your systems, what were the biggest risks or blind spots you had with lone workers that leadership maybe did not fully see at the time? And how did you drive home the importance of addressing it?
Okay, so I think always one of the critical things to do is review what's been there either when you were there or before that even. Look at your historics, go back and, depending on how long your organization has been around and how well you document and retain those records, there's going to be a pattern. If you have any of the travel like things that we have, I'll give an example. It was a lot easier because we had a plane flip over, a seaplane with one of our staff members in it, and they ended up rescuing. They got an award and everything. This was early days in our organization. We've had other cars go off sides of roads. We're on service roads. We've had lack of communication where police, fire, ambulance, everything was dispatched as well for things that were like a flat tire. So we've had these rumblings of inconsistent coverage or inconsistencies that don't match either a small thing being escalated to a large thing because of lack of communication, which is key. Maintaining communication is really at the heart and soul of lone worker and isolation. And so those communication gaps, highlight those, really flag those as like, we need to be able to give the appropriate response. And this is what strengthens that appropriate response, is strengthening our communication pathways. So I think that was a really big driver as well. And then on the violence prevention side, we have the violence, we have interactions with our places. We also have an inherent fear. Obviously, when I look at FNHA as a whole, we have a low amount of violence that happens, but the situations have never escalated, thankfully, to very severe incidents. But they've always been on the cusp. We've been straddling that. And as time goes on, your risk, as we all know, the likelihood of something increases because it hasn't. It's like the great earthquake we've been waiting on the Pacific Coast for years. It'll eventually happen. And so that's that proactive approach that I highlighted before, is that, do we just want to be responsive and be responding? Oh, somebody drove off or got pushed off the side of the highway in a snowdrift, and we couldn't get to them, and they got frostbite, or God forsaken, even worse. Do we want to be that reactive organization, or do we want to ensure that we're going to be able to respond to them and make sure that they know that we can respond to them? That creates that sense of safety and wellness and well-being within your organization. And I think leaders know that retention is a big thing, and that's how you tie all those pieces together on that aspect.
And I think this question that's coming up is an extension of that, or at least in the way I see it. And it's talking about measurement. So how did you go about measuring the impact of these improvements? You talked about some of the issues, you talked about what you did, what was actually working beyond just, I love this, beyond just hoping nothing went wrong.
Yeah. So, I mean, for those that are familiar with the HSMS and CSA standard around health safety management system, we work on the PDCA: plan, do, check, act. And those combination includes, obviously we're rolling out our program right now. And so it's on the onboarding, it's the do. The check is going to be, do we see, what's our usage rates? Are these plans being executed with the way that we envision them? And where we couldn't get metrics before, we can now because of the tools we use, including SolusGuard. We see that engagement level. And we also see where we can drive engagement, where engagement's landing in areas. So that will be how we fold in that check part. And then the act is obviously responding to that check part. That's the PDCA cycle. So we couldn't get those measurements before. We just got the lagging indicators. So that's that
right.
P2 as opposed to safety 1. We're not looking at KPIs anymore. We're looking at live engagement. We're looking at live usage cases. We're looking at, and then of course we expect, even though, like I said, these things are usually big and they don't happen all the time, but we're going to look over long terms. Have we now started to really draw back, or the response to an incident? You can't always prevent every incident from happening, but how is our response to that incident? And how was the workers' ability to deal with that incident? And how has that changed from how it was historically in the past, looking at a comparable incident before? So that's really our goal of how we look at use the PDCA in this terms of working alone and isolation programming that we've implemented.
I'm going to take a step forward, then a step back, because there is some really great questions coming in here, and I can't seem to get them in order. This is my fault as the moderator, but they're just so good. The part that you talked about, the doing part, the implementing part, the question is, you mentioned taking a slow, thoughtful rollout. Can you talk a little bit more about that? How did you find a balance of speed and effectiveness with the rollout?
Yeah, I mean, you have to think about your program specifically. Like, I don't think this is one size fits all, but
right.
I came from the private sector where it's go fast. Your director or VP or executive says, here's a bunch of money, get it done for me in 2 weeks. Well, that's easy enough to do. I have an executive direction. I can go at all the managers in a private organization and say, you have to do this. The executive said you have to. It makes it a little bit easier to a degree, but from the private sector, especially us, we're not for profit technically, and we run on First Nations values. So I had to learn to go slow to go fast. And that involves collaboration, consensus building, and all those aspects that are in our values and directives here at FNHA, which you can look up online. I won't go through them all, but we do have them posted publicly. And one of them is I always go to Directive 7, which is operate at a high level of excellence. And that includes allowing other team operational excellence, allowing other teams to find the operational excellence in the services that we're offering them. We're a support team. At the end of the day, the regulation clearly outlines the responsibilities are on the individual supervisors and managers for their team that they manage. That is the defensive due diligence. So while we can offer services and programming, it's up to the managers and supervisors to champion that. So we really have to have a high level of engagement with each team. That's hundreds of teams across the province. And from a rollout perspective, how do you do 100 at once? Well, we didn't. The reality is we trialed a couple different opportunities, and SolusGuard was a second trial that we did, and we had teams that had trialed another system before. Well, we made sure they were the priority because we wanted that continuity of service. So that was our first approach. Let's get them on board. And then the way we look at it is we had some legacy stuff like Teams messaging. Don't stop doing those things. We had another service called Replay where you can call in. Don't stop using that. We're going to let you just keep using it until we get to you. And so, we're not forcing change right away and scaling up too fast. We are carefully calculated approach and onboarding teams that we see priority in based on risk assessments and hazard assessments. So after those initial teams that participated in the trials, we're finally with our provider choice, which is SolusGuard in some cases. Then we went on to our facilities and corporate services team. Let's get them. They're on the road a lot. They're traveling back and forth. They have a high risk. And then let's go to another big case, which is our health emergency management teams. Let's get all them rolled out. And then we'll go to, we have, like I said, we have legacy teams that are using Garmin's and all that. Well, they have a process already in place. Let's not rock their boat. They have detailed procedures. They have detailed stuff around that. Let that be for now. We'll come to them later. They can be last. And so that's how we've kind of broken it up and approach it. And that's not going to be the same for everybody on this call, unfortunately, because like I said, we are a very diverse and unique system. We have EHOs, health emergency management teams. We have toxic drug crisis teams. We have facilities and corporate services teams. We have oral health teams. And then we have stationary teams or teams that travel hub and spoke from primary care centers and then go out to different communities. So it's just such a large gamut. Don't try to take everything on at once. Break it up into the chunks that are, the high priorities, the higher risk, and work here. And then the teams that are good already that have found solutions on their own, let them still with their solutions. You can get back to them later. And for the teams that had nothing, if they're all low on the priority, they already had nothing. So don't try to rush to get to them. Work with the teams and build out and work out the kinks on your way to getting to them as well, because there will be kinks. Nothing's a smooth 100%. Oh, there we go. Process. It's better to recognize those mistakes early on, perfect your rollout, perfect your change management, and then work with the teams that especially haven't had anything in the past, because those are going to be the more challenging ones. So work with the easy wins first and get to the more challenging later.
And I think that advice applies whether or not the organization is like yours that has a lot of legacy projects and products. As I said, not your first rodeo. And we've been through this historically as an organization. Some of the organizations on this call have actually not yet put anything in place. So they're starting net new, which I could see as both an advantage and a disadvantage depending on the circumstance. But I think your advice rings true regardless of the situation that they're in.
Yeah, absolutely. And I appreciate that some of the people on the call have not started anything either. I always go back though, because we have an example where, we are obviously in the British Columbia regulatory climate. We are very lucky in British Columbia. Some may say lucky. Some owners of private companies or construction companies may say it's a hindrance, but I think it's an advantage that we have very prescriptive regulations. So our act is obviously very legalese, but then the regulations and guidelines are very much written in layman's terms, and they spell out what to do specifically. We're often considered to have the most robust regulations across the province or across all the provinces and territories. And we've run into the things because we're obviously a mix of servicing facilities on federal land or what is recognized as federal land because they're Indigenous. And I've ran into the thing, as one of the challenges of, well, we're federal, we don't have to do that, or we're on federal land, we don't have. That is the furthest thing from the truth. And I mean, as anybody that's in safety here knows, like, that's always a challenge is, well, we don't have to do that. Like, why are we doing that? It's like,
Mhm.
well, the reality is just because your regulation doesn't write it out specifically, you do. And there's no way of cutting around that. And if you want any proof of that, just call, I've known them for years as HRSDC, but they're basically the federal WorkSafe officers that operate federally on federal land. And the Canadian Occupational Health and Safety Regulation is written very, very blasé. It's just like, you must, you're responsible for your workers. But if you read that between the lines, what it is saying is exactly what the BC regulations would spell out, which is that you do have an obligation to make sure that there's contact. You do have those obligations. So, when you're looking for that, I would recommend reaching out to whatever jurisdiction you're in and having a great conversation with one of your, WorkSafe BC or equivalent officers about these things and getting them to write you something that explains and goes into detail, because how they adjudicate it in reality may not be how it seems to be spelt out in the regulation as well.
Yeah. I've certainly noticed from province to province and state to state that there's just significant variations in what the definition of a lone worker is, or even if that even matters, or what the responsibilities are. And so there's definitely the legal obligation of an organization, but it's beyond that, isn't it?
The moral obligation as
Yeah.
well. That's such a huge part and that's why I use the safety maturity scale as a reference.
Right.
Are we really trying to do the bare minimum? Is that what we should attain? Or is that what we're really striving for? Or are we trying to make positive work environments where people want to stay and work at as well?
Yeah.
Attrition is a big part. So that's why I said hitching that wagon to one of those other huge executive priorities is very easy to do if you could, as soon as you can make that connection. So always, hitch it to something bigger and more grander that is going to be in their peripheral and that they can understand too. So that's where the safety maturity scale comes in. And, I always, the BC regulation is good. If you're ever looking for regulations to kind of use as a best practice or to help spell it out, look at the equivalent in the BC regulation. If you're in Canada, in the States, OSHA does a great job, they can be a little bit of ambiguity as well in the OSHA writings for those that are my American colleagues on the call here. But BC does a really good job. It's always been known as doing a good job for that. And a lot of provinces look to the BC regs to improve theirs to a point where some of them might have even surpassed BC in some aspects of the regulation now. But BC does a good cycle every 10 years or so of trying to uplift now based on what's going on across North America. So,
yeah, absolutely. So we talked about the legal. This is a bit maybe on the moral side, but even beyond that, retention. Question, how do we ensure that implementing technology, just technology in general, is culturally safe?
That's a great question. So I don't find things, this is my personal view, of course. Cultural safety and humility is supposed to be subjective. And my fear around it is always being used as a cudgel. It should never be used as a cudgel because that's not using the humility factor of it. And I've seen it used as a cudgel a little bit. But I don't find things like training or technology inherently culturally unsafe. That's not their goal. They're tools. Their training is a tool we use to educate, and technology is a tool we use to elevate. It's how the delivery is done. It's how the interaction around it is done from a human standpoint. And so to make sure that it's culturally safe it's really about making sure that our leaders in that space are aware of some of the things that may be associated with that technology. So, working alone isolations would be, I would think, supervision and the approach to supervision and, non-consensus building and forcing somebody to say, hey, you have to use this instead of making them a partner in it, instead of consulting with them, instead of letting them ask questions and being open to discovering the pathway to what you're trying to make as your point. So I think that's where we introduce cultural safety and humility. And I think that's where we have a trauma-informed lens around it too, is understanding how traumas around supervision and overlooking and oversight can play as a factor. That goes beyond that too, into like unionized environments and the whole tracking thing as well. But But at the end of the day, we're very specific in saying that, teams manage themselves, and the OHS team isn't babysitting anybody and tracking them. It's just about checking your check-ins and making sure you checked in and you're safe. And also the privacy aspect of it, making sure that it's very much outlined what the extent of the information being shared is and to who is it being shared with. And I think we've done a really good job at that and making sure that it's highlighted that this isn't some new thing that we're using to track you and make sure you're doing your job. It's really just about eliminating the risk of your job and making sure you go home 10 fingers, 10 toes, and a steady heartbeat. Kiss those kids goodnight.
Absolutely. I thought I had a mic drop final question for you, but I have actually two here. So we have two final questions. I'm tossing mine out in lieu of these. They're similar, but I'm curious as to how you're going to answer them. So I'm gonna do them both. So the first one is, if another health authority or community organization wanted to follow a similar path, what would you tell them not to underestimate?
Oh, what would I tell them not to underestimate? Don't underestimate the potential for buy-in. I think that's a big one. Like, I think, and don't underestimate the ability for somebody to come around. Oftentimes, people just maybe you haven't delivered it in a way that they can digest it. That doesn't mean give up. That doesn't mean stop. It just means go out and get more information. Somebody, I think this is a tenet is always come with three options. It's pretty standard. A lot of people know, but some people don't. If you come with somebody with one option and one solution, and that's what you really, really want, and you say, this is it, they may not get that. They don't understand necessarily all the nuanced things you do. You're coming from a SME background, right. Subject matter expertise on it. They're not. And so by giving them just one option, you're kind of saying, like, here's your only off ramp. You have to get off here. And that creates a natural confrontation around it. And they're going to want to know a hell of a lot more before they even go for it. So don't let that discourage you. And then, but always come with a couple options and say, like, here's this gets us by. And that's where looking at the safety maturity scale comes in handy too. And representing that. And then here's what gets us through, gets us really where we need. And this would be awesome if we have that. But then they're more interested in finding out more about the options. You haven't just pigeonholed them. So don't underestimate your ability to sell this, in a good way to them, and really just come prepared. That would be where we're not to underestimate. I think generally everything else it's a requirement. We know that. So
yeah.
But I will add one thing: don't underestimate the pushback in some cases. That's going to happen. and not from necessarily your executive and leadership, but from the individual teams too. So there we do have that. But I've always approached, I call it the old guard and the new guard. And the old guard is, oh, why do we need to do that? I've never done that before. This is all new. Blah, blah. My technique has always been bring in the new guard first, because when you bring in the new guard, the old guard goes, well, hey, what are they doing? Why are they doing that? And there's a curiosity that comes. So you can kind of drive that engagement that way too. I find it's been very successful working with everything from longshoremen to hydro and energy guys. And these are very tough cookies to crack sometimes. Yeah.
Before we get to the last question, we have a new one. And so we have a little bit of time. So I want to pop this guy in here. It's a very specific one. What de-escalation training do you provide to your teams, and how often? And for example, we have our employees take annual MOAB, MOAB training, wondering if there are other best practices.
Not familiar with the acronym, but I'm sure if somebody puts in the chat, Serese can let me know. But we use in healthcare, it's provincial violence prevention curriculum. So this was a provincial initiative where we did borrowed and stole from the best, from my understanding of the development of it. And I think it was created in about 2016. Don't quote me on that. But it basically, it's an 8-hour, we have an 8-hour online module provincially, and then an 8-hour in person. And we differentiate a little bit because we very much highlight trauma-informed practice and trauma-informed approaches and elevate that. It's supposed to be the same curriculum across all the healthcare, but every provider, and that's where I say training is culturally safe or neither culturally safe nor culturally unsafe typically. It's really the instructor. So when you get out of the online portion and into the classroom, it can vary greatly. It's supposed to be the same, but it's not always. So there is a refresh going on in the province right now to offer it more. We also have the Physician's Master Agreement or the PMA agreement for physicians. So they've asked for a lot more. As my Canadian counterparts know, doctors are medical contractors basically. And so they don't exist in that same framework of employee engagement. So for them, we're bringing in more doctors and physicians within roles within FNHA as well. And midwives and nurse practitioners fall under the same thing. They're contracted staff. But there is another version of the same PVPC for them being available. So we're very lucky to have that. We haven't had to build anything in-house. We still follow that joint operation, but we are involved in the redesign. We do have engagement. And so cultural safety and humility is one of those things that have been updated and really added to the curriculum as the new one will roll out soon. So, yeah.
Amazing. And apparently MOAB, I probably is doing that wrong, management of aggressive behavior.
Yes, actually, and when as you said, MOAB at that time, I think it did draw on something. Yeah, so I think that was part of what was PVC was also drawn from was that framework as well. So very similar, and there is, and I mean, if you were to feel free to reach out to anybody on the call. You know, I'm on LinkedIn, and you can always ask more questions. And I've always said safety is not proprietary. It's the execution that is. So if you need any help in pointing to resources and getting some insights, I'd be glad to share with you.
Yes, absolutely. Actually, that's a good segue because I was going to mention, I think Spencer was going to pop our email addresses into the chat as well. We're both on LinkedIn. If you need Rob, obviously he's the main draw. If you need him and all of his wisdom, definitely go to him. If you're looking for information on SolusGuard, come to us. For sure. Both of our doors are always open. And I know I say that with experience because working with Robert, even before you'd made a decision, and we were just, getting to know each other, an incredible wealth of knowledge and information, like nothing I'd ever seen before. And I told you that.
I hope my screen is not making me blush because I am blushing right now. Thank you so much. I appreciate it.
It's absolutely true. Again, not your first rodeo. I say that often. I'm from a small town in Saskatchewan where we have a lot of rodeos, so it's just always the analogy I come up with. You have to forgive me on that one. That's my culture.
I'm a city boy raised country way, so I get it 100%.
Okay, good. All right. So I love this one. It's very specific for Robert. Of course, they're all for Robert, but if you could give yourself one heads up to yourself back when you started improving safety measures, what would you say?
Go slow to go fast. That's what I've learned. That is what I have learned. I'm used to coming from the fast-paced environment. I was in private for, like I said, oil and gas, construction, heavy construction, civil construction, marine environment. I was the manager at, on the marine side. So working under maritime occupational health and safety regulations and COSH. And all those things are very much like, here's the problem, go and solve it. Here's the budget, throw it at you. Everything goes your way. Consensus building and conversationalism and relational approaches have so much more value, and I've learned that now. And I advise. I have a right hand here, Erin Bailey, who was with the organization for 7 years. We call her my anchor in a good way. She'd slow me down when I was going too fast when I first got on board here. We rushed to, and I've learned that in parts of my career too. I come from, like I said, the energy sector. People were, there's the opportunity for people to get obviously electrocuted working on power lines. And this is one example. So, but they always get shoulder injuries and so on. And without really thinking, I'm just like, well, okay, well, then stop working at shoulder level, go there. But then obviously you could fall onto the power line. This is early in my career. And there's a reason why they work down there. So I had to adjust my approach, and I brought in physiotherapists to work with our linemen to do exercises and teach them exercises that can keep their shoulders healthy. The other one was working on the marine environment, being like, a lot of finger injuries and people getting finger injuries and why are they getting so many finger injuries? So, oh, you can't wear rings and things when you're wearing
Mm.
gloves. Well, I won't get into the details why, but if you ever walk around along Shoreman Hall and see who's wearing those rings, you don't really ask those guys to take off their rings. So, that's not necessarily a union fight you want to get into, and an organizational fight you want to get into. So, you don't learn these things until you build the relationships. You don't learn these things, and there's other approaches you can take too. So, you're not always going to have wins, but you're going to have an opportunity to get to know people, and is super important. And I think I've learned that more than ever being at FNHA is go slow to go fast, build the relationships, build the trust, and build consensus, build agreement with your vision, let people see your vision, let them adopt your vision, let them want to execute on the vision. And that's important.
I knew it'd be a mic drop moment. I knew it. I knew it.
There you go.
Thank you, Robert, of course, for your insight, guidance, leadership, all of this, putting yourself out there, taking the time to spend with us this afternoon. Thank you to the audience from across North America, all across Canada, the United States. Thank you all for coming. Appreciate it. Everybody stay warm, stay safe, and we'll catch you on the next one.